This video continues Chapter 24 of OEC 6, Abdominal and Pelvic Trauma, by looking at 6 types of abdominal and pelvic injuries. When we look at common abdominal and pelvic injuries, it's important to always consider the MOI. Blunt trauma can affect the solid organs that we find in the abdominal cavity. Penetrating trauma may affect either solid or hollow organs. Considering MOI can help you assess the patient's chief complaint. Now, any trauma to the abdominal wall can appear superficially as bruising or contusions on the skin as a clue to what or where an injury may be inside. One of the first injuries to consider would be to the right upper quadrant, where we find the largest solid organ in the abdomen, which is the liver. Most of the liver is protected by the rib cage, but it still is subject to either type of trauma, blunt or penetrating. It's very vascular, and so an injury to the liver could cause internal bleeding. If you move to the left upper quadrant, we find the spleen. The spleen is partially protected, like the liver, by the lower rib cage, but it's highly vascular, and so a blunt trauma injury to the spleen could lead to severe internal bleeding. Make sure your primary assessment looks for the possibility of shock and checking vital signs. Vascular injuries in the abdominal or pelvic cavity could be due to damage to the larger vessels there, including the abdominal aorta or the inferior vena cava. Rapid deceleration trauma could be the cause. Penetrating trauma, especially along the midline, is also a possibility leading to this type of vascular injury. In any case, bleeding could be severe and immediately life-threatening. At the top of the abdominal cavity, we find the diaphragm, separating the abdominal cavity from the thoracic cavity. Severe blunt abdominal trauma could lead to pressure inside the abdomen, and we can end up with a diaphragmatic hernia. We could also have a penetrating object leading to this hole in the diaphragm, and what that allows is some of the structures within the abdominal cavity to move through that perforated muscle. These structures, mainly in the intestines, could then migrate upwards into the thoracic cavity. This is going to lead to thoracic issues, chest issues, compromising the patient's breathing. If we have an injury to this part of the digestive system, the large intestine or small intestine is found in every quadrant. A penetrating traumatic injury could cause opening to that hollow organ and some of those digestive products to leak into the abdominal cavity. One of the outcomes of this could be infection. Transport to higher care will allow them to treat that. Significant bleeding can occur alongside that, and so we need to consider these possibilities. Blunt injuries to the intestines could be concerning, but their presentation is going to be somewhat delayed. Impaled objects can result in a variety of life-threatening injuries. When we consider an impaled object in the abdomen or pelvis, consider where we find those vascular regions, potentially along the midline, and consider the possibility of bleeding as a major complication. An abdominal evisceration is an open injury to the abdomen where we get a tear in the abdominal wall and the intestines or other organs are exposed to the outside. It's not a common injury, but it would result in severe bleeding and rapid heat loss, and so the potential for shock is very high. Later on, we get the risk of infection. Moving lower, pelvic fractures are something to consider. The pelvic bones are very strong, but they're not immune to some sort of blunt injury. However, because they are so strong, fractures to the pelvis require great force. We have a significant MOI, and consequently, injuries to internal structures can occur. The most significant complication is internal bleeding to a pelvic fracture. Up to 2 units of blood can accumulate there. This is life-threatening, and hypovolemic shock is a likely possibility. Because the pelvis is a rigid ring, It can fracture in more than one location. We'll talk about that in the next video with assessment. The lower urinary tract, including the bladder, is subject to injuries and it's located directly behind the symphysis pubis, one of the lower bones of that pelvic ring. If that symphysis pubis fractures, we can end up with laceration of the bladder. That can occur in the case of a fall or a straddle injury, and that can cause the bladder to rupture. Also, we get deceleration injuries that can lead to this injury as well. Finally, the possibility of genital injuries can occur, such as a straddle injury. For females, that's going to be limited to the external genitalia, but these are highly vascular and can cause profuse bleeding. For males, it can be very painful. The external genitalia, particularly blunt trauma to the testicles, is going to be severely painful and can result in a hematoma there. Lacerations can also occur to the external genitalia.